Welcome back to Angel Vinay Nursing tutorial.
In this video, we are going to study about the techniques of communication. So, what are the techniques we can use for communicating? Okay, let's see. So, some of the techniques will be there to communicate. Okay, so no one person communicate with the same way every time. We generally choose our communication techniques based upon the situation we found ourselves in. But there are some people who predominantly choose one technique over the others. You probably know people that fit pretty neatly into each category. If you find yourself to be one such communicator, take a good look at the category that best describe you and ask yourself if the technique is really effective for you. If you answer honestly, you will probably say no. And if you do say no, then you really need to concentrate on choosing to be a labeler. You will be surprised to see how communication can be change your life, and communication can occur via various processes and methods, and depending on the channel used and the style communication, there can be various techniques of communication. So we have seen that some uh, small essay paragraph. Yeah. So here, what they're talking about here is the techniques of communication. So we have the different kind of techniques to communicate. It's not only verbal, and we can say the verbal and non-verbal. Let's see the techniques here. Based upon the channels used for communicating the techniques, communication can be broadly classified into as the verbal communication and the non-verbal communication. What do you mean by verbal communication? To speak. Yeah, we are speaking. So that is a verbal. And what is a non-verbal? Not speaking. So we are showing some actions. These all things will be coming under the non-verbal. And verbal communications include written, oral communication where the non-verbal communication includes body languages, facial expressions like visuals like diagrams, pictures used for the communication. The person is not able to speak, so what they will do, they will show some of the signs or the facial expressions, right? So they will show pictures and they will write and show. So those all those things will be coming under the non-verbal communication. Okay, let's see. Here you can look at, here is a verbal communication. There are the two things. One is a oral and a written, and the non-verbal communication. So let's see one by one. Okay, the first one is the verbal communication. First one, that in that verbal communication, the words are symbols used by people to think about ideas, to share experience with others, and to validate the meaning of perceptions about the world and one's place in it. Choice of the words is influenced by many factors. Example one, age, race, and socioeconomic group, and educational background and gender. And by the situation in which the communication is taking place, the interpretation of the meaning of words may vary according to the individual's background and experiences. It is dangerous to assume that words have the same meaning for all persons that hear them. Verbal communication is a further divided into oral communication and written communication. So here, as we know, the people think what they are thinking, that they will be saying their ideas. All those things means that they should express in a common medium. Okay, so we are the Indian, so we are the whatever each state maybe wherever we have our this one specific or the particular language. Through that language we will communicate, right? So here I am communicating in English, so you peoples can understand what I am saying. So here we need a common medium to communicate. See, you have seen, no, it's very dangerous to assume that words have the same meaning if all person here hear them. So they will speak something and some other people say something, so they couldn't communicate properly. So we need the main and proper medium for communication, and we need the proper languages understanding. So in that verbal communication, first one is the oral communication. So what is the oral communication? Oral communication means that the oral communication refers to speak words in a communication process. What is that? To speak word. They have to speak the word. And oral communication can either be face-to-face communication or conversation over the phone or the voice chat over the internet. And spoken conversations, dialogues are influenced by the voice modulation, pitch, volume, even the speed and clarity of speaking. The other type of communication is a written communication. So what is that? That is oral communication means they will speak. Okay. In that, they will speak face to face. Either calling, they will call, or they will say that they will message. So nowadays in the WhatsApp, we can record and send the message to the respective person. Okay. So, or else spoken communication, maybe dialogue. So their communication is very important, and they will check the voice modulation and pitch volume. And the speed also. Why we are checking? So if you are speaking very much loud, the person is not able to understand. If you are speaking very slow pitch, the person is not understanding. So it should be have the voice modulation, pitch, volume, and speed and clarity also. And other communication. So next is the under the verbal communication. Next is the written communication. So here is the one and B. Okay. So written communication can be either by mail or email, and effective of the written communications depends on the style of writing, vocabularies, grammar, clarity, precision of the language. Okay. So here through mail, through this normal message chat, text, we will text somebody. So there they will concentrate on, they will clarify the style of writing, how nicely they will write the written communication, that is information. Then vocabulary used, there is standard words they will use, respected. So when you are writing anything, you will write respected sir or madam. So you will write. So that is the standard vocabulary you will be using, and the grammar and clarity, precision of the languages. So these all the things will be coming under the written communication. Okay. So next we will move to the non-verbal communication. What are the things will be coming under the non-verbal communication? So non-verbal communication is deals with the facial expression. As I said, there's a facial expression, body motions. So they will show something expression over their face, and they will show if they don't like, they will show something over the face. And the body motions, they won't mind with body, they will show some actions. 93% of emotional meaning we take from other people is found the person's facial expressions and the tone of voice, and while the 7 percentage is taken from what the person is actually says. Okay, so 93 percentages we can find out the person what he's meaning through his facial expression and body gestures, and is showing that expression of the things and voice modulation, tone of voice. And 7 percentage only we can say, we can understand by their speak. Okay, the non-verbal communication includes what are the things: a facial expression, body movement, gestures, and is commonly referred to the body language. So, we can say the facial expression and body movement and gestures. These three of them we can together call it's a body language. His body language is not good. Why? He is not properly communicating. That's why we are saying his body language is very poor. Okay, so it is considered as a more reliable because it's convey the emotional part of the message. There is a significant danger, however, in misinterpreting non-verbal message if they are not assigned in contrast with the verbal messages. Non-verbal communication include all of the five senses and everything that doesn't involve the spoken and written word. So here, so we can we can understand the convey the message as an emotional part of message. It's very significant in the danger misinterpreting the non-verbal message. So if the person is saying that showing some actions like that, if he is saying that correct message, but his action will be showing is negative, message will be positive. Okay, so what will be, so that message will be misinterpret. Okay, so example I will say you. So if you're going to the patient is died. Okay, so what you will do? So you will say that your face should be very calm and you should be say in a emotional way, not much. Your face should be like that, and you will smile and say means what the this one relatives will be think about that. So is that will be misinterpreting the verbal communications, non-verbal communication should do that kind of things. Then, so in that non-verbal communication, let's see one by one. First one is a personal appearance, second one is the posture and gait, and third one is the facial expression. Then eye contact and personal space and physical contact. Okay, so these many are there. Let's see one by one. Personal appearance. Under the non-verbal communication, what are the thing is a personal appearance. It includes the physical characteristics, facial expression, manner of dress, grooming, and adornments. So his facial expression will be noticed. So that is a personal appearance. And the manner of dress. Okay, when you're going for the morning, so for the death of someone, so how you will groom, how you will be dressed. Okay, so there is a code will be there, so there is a manners will be there, and grooming and the adornments. So these all those things will be showing their personal appearance. Okay, so next one is the posture and gait. Posture and gaits are forms of the self-expression, the way the people sit, stand, move, reflect their attitudes, emotions, self-concept, health status. For example, learning forward conveys the attention. So think about the celebrities. Okay, how they will come? They will come by the new car. Car will be or the luxury vehicle they will use, and they will use the trusses like luxury, and it's very costly. So it's super. We used to say so super. That is their posture and gait, the way others should be attract them, the way they will comes. So that is the thing others want to attract and to reflect or the get the attention for that. So kind of things. And the doctors will see they will becomes in a formal way. They won't speak much. And the hospital they will be very calm and peace and they will show some like what formal. Okay, so that is a post and gate, and it will be coming under the non-verbal. So then we will find out that he is the doctor. He might be the doctor. The way of their attitude. Okay. So next one is a facial expression. Is a smile and frown and raised eyebrow and yawn, a sneer all convey information. Facial expressions continually change during interactions and monitored consistently by the recipient. There is evidence that meaning of these expressions may be similar and across the cultures. Okay, facial expressions here is very important. So the facial expression mainly, obviously we will be we will find out that the eyebrows, yeah, obviously. So the eyebrows will show something as if they don't like something means, and their face will be very angry, or they if they don't like, or if they happy face will be gloom and all those things. So which will convey the information. Facial expression is a continually change during the interaction. When we are interacting, the facial expression will be changing. And so this can be captured by it can be understood by the recipient who is receiving the information, they can understand. Next one is the eye contact. It's very important while taking care of the patient. So we should maintain the eye contact. Here, eye contact is maintaining the eye contact during conversation shows the willingness to listen. Eye contact it also allows people to closely observe one another. Eye movement communicate the feeling and emotions. Looking down on person establish authority, whereas interacting at same level indicate equality in relationships. Really. So if you speak as a very important is eye contact is the when the patient is saying something, like patient is complaining that um, sister, having pain since 2 days, or it's this wound is not healing properly. I have stomach pain. Something is they will say complain to the nurse. So what the nurse should be very keen observer and they should maintain the eye contact. If you're not maintain the eye contact means what will be saying? They will say that they will think that patient will be think that they are neglecting. So they are not bothered about what we are saying, we are not concentrating what we are saying. So there will be the improper communication. So here, maintain the eye contact during the conversation shows a willingness to the listen, and here eye contact allows the people to closely observe one another. So they will think that okay, if you are maintain the eye contact, they will think that yeah, he is understanding, he is listening what I'm saying, he is giving respect to me. And eye movement communicate the feelings, emotions, as you know, guys. Eye movements will be communicate the feeling and emotions, right? While looking at the face, anybody's eye, we can understand what it is in his mind. Okay, so that is the power of eye movement. And looking down, the person established authority, whereas interacting at the same level indicate the equality in relationship. One more thing that is the person is saying right or wrong, or maybe lie, or maybe saying truth, so that we can identify by seeing the eye contact. The thing it is, mainly the person is telling lies means he won't maintain proper eye contact. He will say he will look at somewhere else and he will say, but he will be or anybody he will be um very truth and he's saying the correct things means he will maintain the eye contact and he will proudly say what he done or he faced the whatever thing. Okay, so that is the main thing in eye contact. Next one is a personal space. This personal space, in that the distance one stands from another frequently conveys a non-verbal message. In some culture, it is a sign of attraction, while in other, it may reflect the status or the intensity of exchange. So here the personal space, the distance one stands from another frequency convey the non-verbal message. It should have the there is this distance should be there. Then only we can maintain them. What will we say that non-verbal communication? So if you are showing that all the things also, it should be have the personal space. It should be have the convey non-verbal communication. There is a distance. In some culture, it is a sign of attraction, while in others, it may reflect the status intensity of the exchange. Next one is the physical contact. Shaking hands and touching, holding, embracing, and pushing or patting on the back all convey messages and they reflect an element of intimacy and feeling of attraction. So you have seen some cultures they will hugging and shaking and embracing and putting whatever they will show each other conveying the this one their messages they will say that okay what's up so what's going on so that is the way they will say that physical contact so these all things is main thing is coming under the non-verbal communication what are the things physical appearance and posture and gait and facial expression eye contact personal face and physical contact and what is coming under the oral sorry verbal communication oral and written and next one is the so this is the communication skill, just you have to know. So, non-verbal communication, here the vocal variety and words. Just a diagram. Communication techniques is a 50. So, mainly, so which techniques they will be using more? They will use the 55 percentage of the non-verbal communication and 38 percentage. What is that? Vocal variety and words, it's a 7 percentage. So here, non-verbal communication. So you can see that what we have seen here, non-verbal communication, personal appearance, posture, gait, and appearance, physical contact, personal space, eye contact, facial expression. So this is a way you can write in an exam. So easily examiner can identify so what you are writing, and it's a very what attractive manner to get the score. So This much we have studied. So this is about the what? Techniques of communication based on the communication channels. So hope you guys understand. If you have any doubt, you can ask. And if you want to take any other subject or the other topic, please comment below the description box. Definitely, I will take the classes. And I hope you understood. Thank you for listening my class. Thank you all.